Okay, well, hello everybody, and a warm welcome to socialprotection.org webinar. My name is Ric Goodman. I'm Director of Social Protection and Resilience at DAI Global UK, and I'm also a member of the technical senior leadership team with the staff facility here at DAI. I'm moderating today's webinar, so thank you very much for coming and joining. Today's just a little bit of background, and then we'll go on to housekeeping, a couple of housekeeping issues before we get started on the substance of the presentation and discussion. The STAAR facility is dedicated to expanding and improving the effectiveness of investments in both social protection approaches in crisis and gender responsive social protection. Actors from national governments, donors, implementing partners access support on these topics in the form of independent technical assistance, specialist advice, or bespoke resources. The STAAR facility is financed and supported by FCDO. Strengthening social protection systems directly benefits people living in or at risk of crises caused by conflict, political and economic instability, or environmental fragility, linking traditional humanitarian assistance, which provides the bulk of support to conflict-affected communities, with social protection systems can build people's resilience to crisis while addressing underlying poverty. The STAAR facility has been working for 2 years now and continues until March 26 next year. And our publicly available documents, analysis and blogs, etc., are all available via the socialprotection.org website. This session will be drawing on evidence from recent research by the STAAR facility and BASIC research, STAAR's sister facility program. And the webinar will explore how conflict affects the design and delivery of social protection, from financing and operational choices to the inclusion of vulnerable groups. So we'll be discussing examples from various countries, including Yemen, Iraq, Syria, Ethiopia, the Sahel, drawing out strategies for sustaining social protection systems, leveraging local capacities, and ensuring conflict sensitivity. Okay. Just a couple of housekeeping points. You'll see from the slide that this session is being recorded. So it'll be available following the close of the webinar, along with the presentation that's going to be given. If you'd like to use the chat, I see many of you already are, but please use the chat box to introduce yourself and your organization. Please make useful comments and share useful links there. If you have questions, and we hope you have lots of good penetrating questions, please use the question and answer box, which is a separate chat box, to be able to ask questions of our two panelists, which will be opening the floor to discuss following both presentations. But please state your name and address, contextualize your question or your issue. Please help frame it rather than making just direct comments. And if you would like to have automatic captions, please click on the closed caption button, which is somewhere at the bottom of your screen. Okay, I hope that's all right. So that we are, I'm probably 4 out of 5 minutes into my introduction, so we'll get moving soon. And we're going to have a 20-minute detailed presentation on the findings of the research study, reflections on the study and its findings for a further 10 minutes before opening up the question and answer floor for 20 minutes, and then a closing moment at the end, just to wrap things up. So I'm going to introduce Gabrielle Smith, who has been leading the research that she is about to present. Gabby is an independent consultant working on social protection and humanitarian assistance, and the linkages between these two fields in fragile and conflict-affected settings. She also sits on the technical senior leadership team for FCDO's STAAR facility. Rachel is going to follow up with some reflections on Gabby's presentation in after completion. Rach is one of the research leads on the Better Assistance in Crisis, or BASIC, research program, which complements the STAAR project. And within BASIC, she leads on a program of work on if and how existing social protection programs can be sustained in conflict situations. So I'd like to hand over to Gabby for her presentation. Thank you very much.
Thanks, Rick. Hi, everyone. It's nice to be here. So, as Rick said, I'm presenting findings from this FCDO STAAR study on social assistance in conflict that I led throughout last year. So this has developed 6 country case studies, and these are documenting both challenges and solutions for maintaining social assistance in some form when conflict hits, and building and strengthening social assistance with a conflict lens in countries that are facing protracted conflict where those systems are still emerging. And each case study has been informed by a desk review and around, let's say, 20 to 30 key informant interviews in each country. And they've all been developed in close collaboration with UNICEF and WFP. And each case study sets out both the operational, but also the political risks and constraints, as well as new ways of working that have been tried to overcome these constraints. And they go on to then identify lessons learned, including both promising practices that could be replicated in future, and also key issues and fundamental constraints to address going forward. I'm now working on a synthesis paper, and that provides an overarching analysis and forward-looking guidance of sorts to the sector. And all these resources are due to be published in the next couple of months, the next 1 to 2 months. So today I'm going to share some findings on the political risks and constraints that we're seeing coming out of these studies. And I'll also highlight a few of the key lessons learned. And Somalia throughout is highlighted in red because that case study is still being finalised. It's just approaching sort of 0 draft form at the moment. If you can move to the next slide, please. So this one gives an overview of the social assistance and conflict context for 5 of the countries. So we're not including Somalia yet here. I'm not going to go through this in detail. If you're interested in this detail, you can look at it, after the slides are going to be made available to you. The main thing to highlight on the first row is the difference in the maturity of the social protection systems that we're seeing across countries at the time of the conflict. So relatively speaking, in Ethiopia and Yemen, things are, let's say, partially developed. So they're shown here in an amber colour. So there was a flagship national social protection programme, which government either financed or co-financed. And in contrast, social protection was in a much more nascent stage in the Sahel and in Sudan, shown here in a red colour. And this is primarily donor-led, delivering safety net projects and creating or aiming to create the building blocks for a national system. And then if we compare that to Armenia, shown here in green, this is a middle-income country and has a comprehensive system of benefits. And in several other countries, other UN-supported projects are also linked with the social assistance system and are being implemented in various degrees of partnership with government. And the reports also document experiences coming out of these projects and programs as well. The key thing to highlight in the second row is that the nature of the conflict also varies across countries. So in many countries, a military coup or the presence of a de facto authority has been a factor. In 3 countries, conflict was national in scope, but in Ethiopia it was regionalized. In Armenia, it was cross-border conflict around the disputed territory of Nagorno-Karabakh. And a range of different actors have been involved as parties to conflict. So This includes central governments, also regional government forces, paramilitary forces, non-state armed groups. In Armenia, there was involvement of an external government force as well, and in the nature of Azerbaijan. So if you can move to the next slide, please. So this table presents the political risks and constraints to maintaining social protection in conflict settings, and also the solutions that are emerging or that have been tried. So in all three countries where de facto authorities claimed control of government, the bank's operational policy 7.30 was activated, and that led to a pausing of social protection and other funds to government. And in Ethiopia, the federal government lost control of a region but remained recognised elsewhere, so bank funding continued, but the government paused budget support to the region, including for social protection. And the solution in all cases has been to contract and finance a third-party implementer, so a UN agency, either UNICEF or WFP in each case, to ensure that assistance could continue to reach people in need. In Ethiopia, the Sahel and the Sudan, some donors have had concerns about the central government's conduct in the conflict. So in Ethiopia, this led to delays in donor commitments to social protection, and at least one donor paused their contributions for a period and channeled support instead as humanitarian aid. On the UN-supported programs in these countries, the strategy has been to disengage with, let's say, political figureheads in central government, but to continue to engage with technocrats and with decentralized social protection institutions and frontline workers to maintain support to people. In some countries, conflict dynamics have influenced government decisions on targeting. For example, there's been attempts to exclude some populations that are living in opposition regions or from areas hosting non-state armed groups. And government and armed groups have also been implicated in humanitarian aid diversion. This was the case in 3 countries, so in Ethiopia, in Burkina Faso, in Somalia. And because of that, there's been concerns that similar risks could also apply to social assistance. And the slide, you can go through this in your own time, but it highlights that various measures have been taken to try to address these risks as well. In Ethiopia, the federal government was reluctant to share clear information on social protection functionality in conflict-affected areas because doing so might undermine its legitimacy. And in response, donors introduced various independent monitoring tools and spot checks to try to regain confidence in that information. In the Sahel, this is also emerging as an issue, this interest within governments to downplay loss of control of territory to non-state armed groups. If you can please move now to the next slide. So this highlights some of the lessons learned that we're seeing emerging from the study. And this hasn't been a robust evaluation, but what we are seeing is clear consistency across the countries on the issues and the lessons that are emerging, which does add further weight to the findings. We're seeing that certain features of the social assistance system can make it easier to maintain social assistance during conflict. So this includes things like program design features. So as an example, unconditional, unrestricted cash transfers are easier to sustain in insecure settings than modalities like cash for work or economic inclusion measures. Digital delivery systems, where they exist, have been a really key enabling factor. In several countries, the continued engagement with subnational social protection institutions has been a really important part of maintaining delivery of assistance at times of conflict. The findings show that there are ways to maintain engagement with government in conflict settings. So this isn't something that's risk-free, but there are ways to mitigate the risks. So we can introduce additional measures and controls, we can bypass certain institutions or partially bypass, we can channel funds in different ways. And government also does not comprise a single homogeneous body. So there's a range of institutions, there's a range of levels of government that are involved in social protection provision. So from senior bureaucrats to district officers to frontline workers, not all of these actors are implicated in conflict. And we're seeing it is possible and important to still work through and to still engage with technical levels of government and social workers in particular. And the fact that the underlying politics of a conflict and the parties to the conflict can vary, as we saw earlier, this means that different conflicts present different risks for social protection. And Armenia is a really excellent illustration of this. So here the conflict didn't create any sensitivities about actions against civilians or about diversion of funds or about manipulation of targeting. So occurrence of conflict per se is not a red line for donors choosing or not choosing to maintain engagement on social protection. And there's a need to really understand the political economy of the conflict. Findings are showing that third-party implementers offer good potential for maintaining assistance to people when donors can't channel funds to government or where government's ability to deliver services is constrained because of the conflict. At the same time, we find that these models certainly need to be improved on. So there's a need for better preparedness. So implementation was often delayed because the World Bank didn't make decisions to switch to a third-party implementer immediately. They were opting, understandably so, for a wait-and-see approach. And because of the time needed for contracting the UN and the negotiations that are involved in that. So perhaps having some sort of global templates for contracting and data sharing or setting pre-agreements in advance of a crisis in fragile states could help. There's still a need to generate rigorous independent evidence of the actual effectiveness and efficiency of these models. And success of these approaches is based partly on the involvement of local partners that the UN subcontracted. And so some key informants queried the cost efficiency of these pass-through arrangements and felt that there's a need going forward to consider ways to more directly involve national organisations in delivery in future. And experience shows that it is possible and important for these third-party implementation agencies to find ways to still work with some social protection institutions rather than move to full parallel systems through corporate mechanisms. And we also need indicators to inform a pivot back to government-led ways of working after the crisis has passed or the worst of the crisis has passed. The World Bank and donors' interest to maintain social assistance, despite political fragility and conflict, was very much welcomed. There were also consistent reflections across countries that this engagement needs to improve. So as examples, the sorts of things that we heard were that the political dynamics of conflict on social protection and on social protection system building need to be better understood and better factored in. That there should be more involvement of conflict experts in the design of safety net systems. That pausing of funds is problematic when alternative solutions are not put in place immediately for sustaining assistance to people. There was also some criticism in some countries of low risk appetite of donors to engage with governments in some contexts, and key informants felt that the risks of engagement need to be weighed against the risks of non-engagement and on what that means for assistance to people. If you can move to the last slide, please. So finally, I just wanted to share the lessons that are emerging around linking humanitarian action and social protection. So there is a lot of talk about working across the Nexus and about linking humanitarian action and social protection in fragile settings. In practice, it's still not happening well. And this issue came up in Somalia, Yemen, Sahel, and also in Armenia. So these case studies highlight a reluctance among humanitarian actors to engage with government and government systems. The problem with this is probably best illustrated by the case of Armenia. So this is one of the most enabling environments that it's possible to have in order for international partners to contribute to a government-led social protection response. It's a stable state. There's no historical long-term humanitarian presence in the country. There's a strong government. There's a strong social protection system. There's no protection concerns about government's conduct in the conflict, or concerns about diversion. And still, some humanitarian organisations were saying they were unable to put funds through government or were reluctant to share data back with government. And there were still concerns from some humanitarian donors, at least initially, about using government data for targeting. And there's been creation of a costly parallel system as a result of that. And there was a lot of criticism of this coming out of key informant interviews across the countries from dual mandate agencies and from development stakeholders. And whilst key informants do appreciate that there are some legitimate concerns from humanitarian actors, we're not saying that that isn't the case. They were also, however, critical of barriers that they saw being caused by a lack of flexibility in humanitarian donor instruments or by a lack of understanding or exposure to social protection and government systems. And the main perceived reason that came out consistently was that implementing agencies are at times acting in their own self-interest. And some key informants talked about this idea of hiding behind humanitarian principles. And a related point to that is that there's still a narrative that delivering assistance outside national institutions through the parallel humanitarian system is necessary to protect aid from interference or to deliver it impartially, when the reality that we're seeing from the aid diversion scandals that I mentioned earlier is very different. So rather, all aid is facing these pressures. It isn't only aid that's delivered in partnership through government. So I would argue, and this comes out in the synthesis report, that we need to think about how we can move away from the status quo, where we're making, fairly generalized assumptions about the inherent risks of engaging with government, towards more informed assessment of what the actual risks might be and consideration of how to mitigate these rather than pure avoidance strategies. And we also need to find ways to better balance the application of humanitarian principles with social protection system building principles. So this isn't to suggest at all that these humanitarian principles should be thrown out or disregarded, but we do need to ensure as a minimum that we're not applying these in a vacuum. So humanitarian action delivered independently, it's still going to have wider impacts on social and political and economic systems in a country. And if by doing things outside government or refusing to share data with registries is ultimately constraining progress towards the Nexus or towards development of systems that can reduce reliance on humanitarian intervention in future, and this is potentially problematic. And maybe this is something we can talk more about in the discussion. And the final point here is that there is still limited coordination and cooperation between social protection and humanitarian actors, and that's needed really to overcome some of the issues that we're talking about here. So we saw across the case studies that humanitarian and development donors are not joining up strategies to align social protection and humanitarian assistance efforts. There's no common understanding or shared vision across the different houses of donors about whether or how to work together on this. And the biggest gap that was seen is around how to better support protracted humanitarian needs. So some humanitarian donors, again, understandably so, are aiming to focus more on new acute humanitarian needs. But that means this gap in protracted need is not being picked up by either humanitarian or development counterparts. So that concludes my presentation. I'll hand back over to Ric now. Thanks very much.
Fantastic. Thank you so much, Gabby. Very succinct, very direct, very clear. I'm sure we're going to have lots of questions and additional points to raise, and examples and reflections in due course from participants on the webinar. Before we do that, we are privileged to have Ric Slater with us to provide some reflections and feedback of Ric is doing complementary similar work on many of the same issues, focusing including on Iraq and Syria that are not countries covered by your research, Gabby. So as I mentioned earlier, Ric is one of the research leads at BASIC Research, Better Assistance in Crisis research program. And her focus is on of if and how existing social protection programs can be sustained in conflict situations. The focus is not, can we scale up our program and reach new people, but rather, can we keep pre-existing programs delivering for existing beneficiaries? So the sustain and maintain of social protection programs and the kind of long-term development track. Ric, over to you, please. Love to hear your thoughts.
Thanks very much. Good morning, good afternoon, everyone. As Ric said, I'm part of BASIC, Better Assistance in Crisis Research, which is a sister project to STAAR, where Gabby has been doing this work. I'm going to make some comments that draw on my own reflections on what Gabby's work has been finding, but also draw on what we're doing in basic research. And as Ric said, especially picking out things like what we're finding in Syria and Iraq. And I've got 4 key points that I want to make. The first one is to add another angle to what we've been hearing from Gabby. So a lot of what she's focused on at the request of the people who funded the work that she's done has been around the systems that we have and the approaches that we take to trying to maintain or sustain social protection programs in crisis situations. And I think it's not an accident that she's been asked to focus on that particular part of the puzzle. I think one of the things that we're often guilty of in international development practice is a focus on our approaches, the technical systems that we have, and perhaps forgetting about the people who actually do the work to deliver the programs. So we get preoccupied with digitization and how that can help us sustain delivery of social protection, or preoccupied by how better or improved MIS systems might help us. But we talk very little about the workforce. And if we look at investments in sustaining systems, we see these really big systems architecture investments, but very little reaching social protection workers on the front line, on the ground. And Iraq is a really good example of this. So millions of dollars spent on improving centralized admin and MIS systems. And all that really makes it down to social workers at the local level is a tablet. And a tablet that's arguably serving the centre, delivering data to them much more quickly. The benefits to social workers themselves of the investment that they've received is not altogether clear. And in Iraq, the other thing that I want to flag here is the evidence that we do have shows that social workers in some parts of the country are struggling to do much more than verify and validate targeting and registration. So the things that we ask people to focus on when we make these big investments in MIS and systems are often creating very, very narrow jobs for people at the local level. And all those other activities that are critical to sustaining our programming and the outcomes of that programming, like linkages with wider programs and entitlements that are delivered by social protection workers, these things don't happen. So that's my first point. Let's make sure that we also get the angle of the people who deliver programs. The second point comes when we start to unpack this a bit. So if we start asking about questions about the capacities of social protection workers and what happens to them in crisis and conflict situations. Now, the work that we're doing in BASIC is focused explicitly on this question. And so we've developed some new ways of thinking about the capacity of social protection workers to help us with this. And, you know, as I think we all know, but perhaps don't acknowledge often enough, capacity is one of those fuzzy words. We all say it all the time. We all have numerous expressions of policy recommendations in which we need to increase or enhance capacity, but we very rarely define or delineate what we mean. And we end up with a focus on knowledge, a focus on the technical skills, and we end up with capacity development equals doing training. Now, in the kinds of places that we've been working, this isn't a helpful way to think about it. In Syria, when social protection workers or social workers aren't delivering on their jobs, it's rarely because they don't know how they're supposed to do it. It may be that they themselves are displaced. It might be that their home has been destroyed by bombing or their children have been injured. And we're not good at understanding the impacts on social protection workers. So what we're doing in BASIC to try and get over that is differentiating between 3 types of capacity: competency, capability, and performance. And I've just posted that into the chat box so you can see it. It's a word salad when it comes out of my mouth, but hopefully seeing it written down helps. So competency is what people can do in principle. It's what they've been trained to do, what they have the knowledge to do. And it's the idea of if we could all do our jobs in a laboratory, that's what we would be able to do. Capability, on the other hand, is what happens in practice when we get into the real world and when we have to deal with real life situations. So in Syria, that's social protection workers having to negotiate across a military checkpoint to reach recipients. Are they able to do that? It's about them finding ways to continue working when there's a curfew or a power outage. And what we find with these capabilities is that they're much softer personal and life skills. They're not those hard technical skills that we often focus on. And then performance is about what people actually do. And here we're talking about whether social workers in Yemen do their jobs if they haven't been paid for years, or whether workers in Syria who have lost family members to the conflict are still able to function at a good level. And what we're finding overall, especially in Syria, Iraq, and Yemen, is that there are substantial capacity deficits in areas of capability and performance, but all of our investments are in competency. So we need to find ways to build soft skills and not just focus on hard technical skills. The third point that I want to make is a reinforcement of some of the issues that Gabby has raised in her challenge to the application of humanitarian principles. She's flagged that if we stick to a very blunt, unnuanced view of principles, then that can seriously hinder our efforts to sustain social protection. I think we can take it even further than that. I'm often confused why humanitarian principles are inflexible, but in conflict situations, social protection principles and values, all of those things that all of our countries have signed up to in terms of rights and entitlements, they all get dropped really quickly. So why is one set of values set in stone and the other set of principles ignored or dropped? And I think I'd argue that there's a need for us to recalibrate the balance of power between humanitarian principles and social protection principles, and for international actors to start rethinking the way that they apply them. If I was trying to be even more provocative, I think I'd say that we need to be aware of thinking that strengthening linkages between humanitarian and social protection is automatically and always a win-win. There's the potential to do more harm than good with humanitarian linkages if it distracts us from core existing social protection programs and life cycle approaches. And those are the things that we really care about when we're talking about sustaining existing programs. There's that risk that social protection just gets subsumed in the service of humanitarian responses. And the bit that really worries me about that is that existing chronic and life cycle vulnerabilities and poverties don't just disappear in a conflict situation. They continue to underpin social protection needs, but we're often losing our focus on them. And I think it's particularly key, as Gabby's pointed out, when we start talking about third-party implementation, that we don't lose sight of those long-standing chronic life cycle vulnerabilities. So final point is to pay a bit more attention to other sectors. So across all of the things that Gabby's raised and things that I've raised around workers, things that she said about third-party implementation, about principles and so on, I'm really interested in how much we're staying in what I would call the linkages bubble. So those of us who work on humanitarian social protection linkages are spending a lot of time looking at how we sustain programs and having a conversation amongst ourselves, but we're not really looking to other sectors to help us. So in Syria, back there again, health workers and teachers get lots of attentions, both in humanitarian needs overviews, but also in development efforts. We learn about the loss of the workforce, we frequently monitor them and we assess them, but we don't do that for social workers or social protection workers. Internationally, funding of health and education government workforce is something that we are willing to do and that we commonly do, but we don't do that for social protection workforce. And then finally, there's lots and lots of experience from both the health and education sectors of using TPIs and indeed the private sector to deliver. What can we learn from this about how to do the same in social protection? So with those 4 points in mind, I think I want to make one final point. And that's, as a social protection expert, I still find it really difficult to have some of these conversations with conflict experts. And Gabby's picked up on this already. And I think I'd stress that it's not enough for us to keep talking in our humanitarian social protection bubble about this. I know some organisations where the social protection leads are trying with only very limited success to bring conflict expertise into this conversation about how we sustain programmes. And so I'd really welcome any sharing about how we bring that conflict angle in better than we're doing so far, because I think that's the key to unlocking sustained social protection in conflict settings. Thanks, Ric.
Super, thanks, Rach. Two fantastic overviews and insights into and reflections on lots of the dynamics that we've been observing and discussing over recent months, emerging from our our work with many of you on the webinar this afternoon. We are going to open the floor for questions and hopefully some answers or some further reflections from Gabby and Rach. If I could ask you to use the Q&A button, which is at the bottom of your screen, to pose questions. So rather than using the webinar chat, which is scrolling past me, there's a separate button for question and answer. We have one opening question from Jeremy, directed at Gabby to expand a bit more on Armenia. Gabby, if you can read that, but could you please say a bit more about incentives that encourage international actors to continue support to the social protection system there, if Jeremy's understood you correctly. But please, in the meantime, could others can make questions into that box. Gabby, your microphone's mute.
Sorry, am I on now? Is that better?
You're on.
What were the incentives? I mean, so there was one of the things that helped was a forum that was developed, a joint forum that brought together government and humanitarian actors. That certainly helped. Another factor was sort of fairly, forceful advocacy, partly from government, but also from other development, let's say social protection partners, one being the World Bank, one being UNICEF, directed towards humanitarian organisations. And the forum, having a forum that brought together both sides was conducive to dialogue and to trying to sort of, I guess, see the points of view and the risks and the concerns from both sides. One of the donors that were initially, let's say, reticent to use government data for targeting, as a result of these, joint conversations, then did change their stance in the sort of second phase of the conflict. In Armenia, there's the case study goes into more detail. There's sort of two conflict, let's say, iterations. There was a one in 2021 and one in 2023, which is the protracted situation that we're seeing now into 2024. And so by the second conflict, that particular issue around donor reluctance to use data had been resolved, but some of the other issues remained throughout the response. And really, I guess it's not about incentives to overcome that we're seeing in the case of Armenia. It was incentives to maintain the status quo, and that's what organisations and key informants were criticising. And I think part of it came down ultimately to self-interest and this desire to access donor financing. Ultimately, all these organisations are in competition with each other, and the performance metrics that we're using in the aid system value resources through corporate systems and hard delivery statistics, numbers of people reached, number of dollars dispersed over maybe some of these more, maybe we use the word soft again, these more sort of soft targets around, support to governments, etc. So I don't know whether that answers your question, but yeah, there were certain things that were, I would say, incentives to doing things better that saw results, and then other things that remained hard disincentives not to collaborate or not to change the status quo.
Thanks, Gabby. I'm gonna go back to the chat. Lara, I'll come back to your point, maybe your magic wand question, maybe later down the track. I'd like to turn to Serene's question and kind of maybe responds to Rachel's challenge of focusing on frontline workers. I think there are a number of points there to unpack. Is why there is an overriding emphasis on cash transfers rather, and social services tends to be underinvested and forgotten about in conflict situations. I also think that a lot of governments and aid agencies find it find it very difficult, and the default is to design centralized command and control systems and ask for data input from the front line rather than to empower and design from the bottom up. Serene's question is, if you have any thoughts on how to support a government frontline workers where the costs of that are not being met by government, and I presume the further point is not being supported by donors either. This change of approach is not cost neutral. So how do we make a start on that?
Is that for me, Rick?
Rach, maybe you could have a start. Yeah.
Yeah, okay. I guess the first thing is, I was looking at the comment that Serene made in the webinar chat box as opposed to the question, and thinking about both that and the importance of having systems in place, but not just social protection systems, wider systems like ID systems, and then trying to simultaneously think about what do you do when there's such limited funding for frontline workers at the local government level. Part of the answer to the question is get out of your social protection box, because one of the things that we're really, really bad at doing is making an investment that benefits more than one sector. And actually, when we're working at the local level, that's what we're going to need to do. It's, we've made loads of progress with things like one-stop shops and service counters where people can go and get access to multiple different kinds of services, not just social protection. And so they're clearly the models that enable us to work efficiently and effectively at the local level. But whether it's in the case of delivering social protection or whether it's in the case of building capacity to deliver social protection, we, and I think in other sectors as well, are really reluctant to put money into something more generic. So, I remember working in South Sudan and suggesting at one point that the best investment that you could make in social protection capacity would be a generator, and that generator might well be shared by a social protection office, a health officials office, the local education office, and so on. But there's a reluctance to invest money that has that broader cross-sectoral purpose and benefit. And so perhaps one of the things that we need to do is ask ourselves, how can we encourage different sectors to make investments in capacity into a pot that can then be more effectively deployed at the local level? And I think that's part of the way that we start to think differently and get over the challenge of how we transfer and invest in local level institutions, organizations, and systems. I'll stop there.
Great, thanks, Rach. So I want to take Becky's question back to Gabby now. Also on local actors, how did they help with sustaining social protection systems in a conflict? From the case studies that you've looked at, what are the lessons drawn for how international approaches helped or hindered these local actors?
As Becky knows already, we saw this come up in the Sudan case study. We've also seen it come up in several of the others, and they've helped in a number of different ways. They've helped in like what Rachel was saying about those sort of the soft skills, the negotiating power, the convening power. The trust that these local organisations and local stakeholders have within communities, and the granular understanding of the conflict setting. So there's been support with access, with securing access, with negotiating access with all the different parties to the conflict. And there's been outreach to beneficiaries or prospective beneficiaries of social protection programs to ensure that they are sensitized on any changes that might need to be made. They've been engaged in hand-holding to ensure accessibility for vulnerable or marginalized groups. They've been involved in various ways in monitoring activities and in grievance mechanisms. And different local stakeholders have been involved in different country contexts. So, if we think about the phrase local actors, what exactly are we talking about? So in many cases, it might be sort of decentralized workforce within, decentralized administrative workforce within the social protection system itself. In other contexts, it's included more community-based organisations. So in the case of Sudan, UNICEF worked with these mothers organisations and the leaders of those mothers organisations, just as an example. Over.
Yeah, I suppose it's also related to discretionary authority and empowering social workers to make decisions around case management. They obviously see things on individual cases that is impossible to see from the centre when you're very much data driven and trying to standardize and the implementation of a particular approach.
Yeah.
So yeah, and related to that, I mean, Alex's point that social protection, pre-existing social protection programs at best would be 20% of the population. A humanitarian crisis emerges, and maybe there is some overlap with that caseload, but it might well be distinct, different forms of requirements, different population, different geographies, different demographics, etc. So how do we, given that, how do we continue to sustain both service delivery to that pre-existing population as well as scale up in light of emerging humanitarian needs?
Shall I put my hand up to answer that one? Shall I go ahead, Rick?
Fine, please do, Rachel. Yeah.
So I think one of the problems with our humanitarian assistance, social protection linkages is that we reduce social protection down to social assistance. And actually, social protection coverage is often an awful lot more than 20% of the population. Social assistance may well be very, very small, but social protection is often far bigger. It may be transient in some ways, but it's far bigger than that. So if you look at Iraq and Syria, social assistance, very, very small, essentially collapsed completely in Syria from around 2013 onwards. But subsidies, so the PDS in Iraq and various subsidies in Syria, continue to cover vast swathes of the population. And so I think one of the things that we do that we make a mistake on is reducing what's happening in social protection down to only social assistance, and thinking that because that's the place where we can connect best with humanitarian responses, that's all we really need to think about. And I think there are one of the things that has come out really strongly for us in both Iraq and Syria is that where you have a social contract that makes it very, very difficult to remove a particular kind of social protection program, like subsidies in Iraq and Syria, that they're essentially part of the Ba'athist historical Ba'athist Party contract with people in both of those countries, that we need to look to where some of the answers are in those existing contracts and not try and come up with a whole new model that doesn't really exist, like social assistance. And so for me, I think trying to respond to that, we may have a role in building up social assistance, perhaps starting with humanitarian assistance and then trying to make that transfer back across to government. But we need to recognise that that's not actually the main player in the environment or in the landscape, and that we've got to pay attention to all of these other forms of social protection that exist. And I think the final thing that I'd add to that, which is linked to what we've been saying about what happens locally, is that we are way behind on understanding the extent to which informal systems and volunteer workers are holding up the system of social protection or some sort of mutual reciprocity system at the local level in most of the countries that I work in. And we've really got to get ourselves doing better on that one. Over.
Yep, very good reflection. And there's, there are more tools in the box than cash transfers. There's remittances, there's traditional forms of redistribution, there's reciprocity. They're way underutilized, and facilitating transfer and redistribution of the resources available is often a better answer than a standalone design program. I'm struggling to listen to the deep conversation with the reflections, as well as read the very good questions being put in the Q&A box. Thomas, you're asking what I think is that a question around how does humanitarian assistance impact the kind of the pre-existing inequalities and access to resources and balance of power, rather than work to address that in the longer term. Gabby, is there anything else, anything that's come up from your research around those dynamics, kind of the unexpected, possibly negative impact of the humanitarian economy in a conflict situation that has come to pass?
Are you looking at Thomas's question?
Yeah,
I interpreted it slightly differently.
I
thought he was. I'm playing devil's advocate. I thought it was more directed to what I was saying about. I don't know. It relates to financing, doesn't it, as well? Around this idea of where we focus on humanitarian. I'm reading it to myself. Humanitarian priority to action as the provider of last resort for life-saving assistance intersect with this need to provide ongoing provision of basic needs for destitute populations. Don't know if I'm making sense.
Thomas, you're going to have to
rephrase
your question because we're confused.
I did have an answer, and now I'm losing it again. Thomas, do you want to come in?
Participants can't speak on mic, so
Okay.
Tom, you're going to have to rephrase the question. Okay, we'll come back to it.
I did think it was about financing, but now I'm second guessing.
Okay, all right. So we'll go back to Carla. Raised two questions for both Rach and Gabby related to Occupy Palestine. To Rachel, isn't the key issue also that international humanitarian donors are unable to directly fund host governments to deliver social benefits and social protection? And also to Gabby, what was or could be the role of the resident coordinator's office, if they have a role at all, in bridging this gap of coherence between the international humanitarian assistance and national social protection delivery? Gabby, do you want to, given you're on mic, do you want to address the second question first?
Yeah, it'll be a short answer. The first bit is I didn't really find any not at least a a sort of clear or explicit role from the documents I read or the key informants that I interviewed. Potentially, yes, they absolutely could have a role, and this sort of locus, this could be the locus of coordination that sort of brings together both sides if they're incentivized to do it. I think the question is how you ensure that that role is developed in an effective way, and one of the things has to be around, I guess, ensuring that that mandate is clear within the within the rules of the humanitarian coordination system, and doing more maybe to build understanding and expertise around around social protection systems and what to look for. And one of the things, I'm still drafting this synthesis note, but the end part of that synthesis note, I won't be providing all the answers, sorry to say, but it's going to be posed more as sort of forward-looking questions about, well, what needs to happen to address this challenge, and then some sort of reflections under each section. And one of those sections is definitely going to be around the coordination system and the extent to which that can provide some of these answers. Yes,
thanks, Gabby.
With that in future.
So we're very near time, but I just wanted to have a very quick magic wand question, going back to Lara's what Lara's posed. You have a magic wand. What would be one thing that you would like to see changed? Quick answer, if you could, please. One to Gabby, one to Rach.
I did write down 3, but I will. I'll say them really fast. I would change things on its head, and instead of having it as I guess like humanitarian principles first, I would turn the question around and say, why not social protection first? So we have to justify why we don't work through social protection, as opposed to why we do work through social protection, in places where it's clearly a context of fairly strong political fragility. I would put in place measures to anticipate and then switch on quickly alternative means of distribution of assistance when it becomes impossible to work through government, or government suddenly has a deterioration of capacities. And I would start building a decentralized social protection workforce.
Okay, great. And Rach, one quick magic wand.
I'd written one into the answered box, but I guess I would say that if you want to embody humanitarian principles, then you really have to live by them yourself. And that means if the government shares data with you, you've got to share it back.
Fantastic. Very succinctly put. Thank you very much, Gabby and Rach. And I'd like to pass over to Paolo at socialprotection.org for a closing statement. Thank you. So thanks very much for joining this morning. Just to say that you can access the presentation and slides from the and recording of the webinar at socialprotection.org shortly thereafter. And we'd love to hear your thoughts and feedback on today's session. You can do that by using the QR code with your phones, which is on the screen in front of you. But other than that, thank you so much for joining. Thanks for a fantastic discussion. And once again, thank you so much to Gabby and Rachel for presentation, thoughts and reflections. And thanks to our host at socialprotection.org. Have a good day, everybody. Bye now.
Thanks, Rick. Bye.